Black Health Alliance. There's been 3 pieces of legislation over the last, going back to 2006, which all speak specifically as it relates to health. And these pieces of legislation collectively talk about providing a healthcare system which is accessible, which is equitable, which provides, which is focused on reducing disparities and inequities, which is supposed to have commitments on health promotion, and which is also supposed to respect the diversity of communities and involve them in the implementation, the planning, and the development, and so forth. And so, despite these legislations, these are currently existing legislations, members of the Black community, second next to probably the Indigenous community, experience a significant burden as it relates to health.
Yeah.
We are twice as more likely to have diabetes, hypertension, and the complications thereof. In terms of mental health, the funding allocated for mental health services for the Black community are significantly lower than they are for the white community. We find that HIV and AIDS, the number of incidents in HIV, newly diagnoses, 65% of them are Black women in the province of Ontario. So despite, not to mention, many of us, when we go to frontline healthcare services, there are experiences of anti-Black racism which further impacts the outcomes that we receive. So despite the existing legislation that's in place and the experiences of many of us in the community, there's a clear imbalance. So my first question is really, what will you do as a Premier, as a leader, to rectify and create an accountable healthcare system which is going to reverse this trend?
1 minute, please.